What do you need to know before getting a rhinoplasty? Dr. West is here to tell us. I'm Anita, and this is Care Experts. Today we're talking about rhinoplasty with board-certified plastic surgeon, Dr. Justin West. Thank you so much for being with us, Dr. West.
Thanks for having me.
So first of all, tell me what exactly is a rhinoplasty?
Rhinoplasty, think of it as shaping your nose. So somebody who comes in and they don't like the tip of their nose, they think their nose is too long or too wide. There's a variety of procedures that we can do, like hundreds of little maneuvers in this very small space to reshape a nose to make it either more proportionate or more shapely to sort of hit the aesthetic standard the patient's looking for.
So what exactly is the difference between a rhinoplasty and a septoplasty?
So the septum is a very specific part of your nose where it runs right down the middle. There's a bony septum and there's a piece of cartilage also. If somebody comes in and let's say they have a breathing difficulty, so very few people have a perfectly straight septum, and so it typically deviates a little bit to one side or bows in. Well, if that happens, you're going to have a hard time moving air through, let's say, a nostril. So in a septoplasty, we can go in and we can manipulate the soft tissues to move it over so it's running more midline, so that in those patients you can see a nice improvement in their ability to breathe.
Are there health benefits with a rhinoplasty or a septoplasty? I know obviously you mentioned that the septoplasty can just help you breathe better.
Yeah, that would be, I think, for a lot of patients, a tremendous benefit. For a cosmetic rhinoplasty, I would say, the benefits are different, right? Mm-hmm. It's how you feel. It's more alleviating anxiety or, being less self-conscious. So I wouldn't say it necessarily falls into what we call like a classic sort of a medical concern, although if it's causing anxiety or depression, then it sort of also does. But yes, I would say we divide it into aesthetic surgery and functional surgery. Right?
Okay.
Functional being, can we help you breathe better? Aesthetic, can we change the shape to an aesthetic that maybe matches what you're hoping for?
Can you walk us through the procedure just briefly, what that would entail?
Sure, yeah. So in a typical rhinoplasty, what we're going to do is we're going to open the nose in one of two ways. Either we do what we call an open rhinoplasty, where we make a little incision down at the bottom, and then we'll actually lift very gently the skin off of the structures of the nose, so lift it off of the bone and cartilage, and then we're just making little manipulations to the cartilages and to the bone that make up the architecture of your nose. And then we put the skin back together. The scars are really subtle. You can also do what we call a closed rhinoplasty, where we make the incisions inside the nose, and you're still making incisions, but they're particularly well hidden. But the truth is the scars are so small from an open rhinoplasty, it really kind of comes down to dealer's choice. Some surgeons are trained a certain way. I always tell patients, let them use the approach that they do best. Yeah. I don't think that necessarily, there's some maneuvers that might be easier one way or the other, but for the most part, let the surgeon approach your nose how they like to do it.
And what is the recovery like? Is it painful, or is there any problems breathing afterwards?
Yeah, so depending on what we're doing, if we're doing anything with the septum, we often put in little packs so that we can mitigate bleeding issues after surgery. Those packs could stay anywhere from 3 to 5 days. A little bit of discomfort when those come out, but really at the end of the day, not such a big deal. People are bruised, they're swollen. Sometimes you get swelling and bruising that extends out to the cheeks. And so there's kind of, you will look like you had surgery, right? You are going to walk out with a splint on your face. Yeah. This isn't the kind of thing that you hide under a t-shirt and nobody knows what you're just doing in that surgeon's office, right? You go out looking like you just had a procedure. The splints usually stay on anywhere from 5 to 7 days. So a lot of people don't want to go to the supermarket or go out or see their neighbors. So for some people, it's hiding at home for a week. Yeah. And then by the time the splint comes off, now you don't have that telltale sign of the splint being present, but there's still often swelling and bruising. But there's also products that we can use to help mitigate that. So there's plenty of patients who will go out the day after surgery because they just don't care. Mm-hmm. Some people it's a week later, some people maybe more like 2 weeks.
Talk to me about scarring. I know this is right on your face. So is the scar going to be evident? Do they heal over time?
These are really subtle scars. So, if you're doing a closed approach and you're making incisions inside the nostril, no one's going to see that but your plastic surgeon, because very few people look inside your nostril.
Yeah, hopefully.
Right. The external scars that we use, we do it down on the columella, which is the lower part of your nose. So if you have somebody shorter than you who's looking up and staring at your nose, which would be kind of a weird thing to do, yeah, they could theoretically see the scar, but they're typically very hard scars to find even for us. So, when I talk to people socially, I don't typically look at them and say, oh, you had a rhinoplasty, because based on their scar, you might see a nose that just seems almost too perfect and say, I wonder if is that yours or did you have surgery?
Yeah. We'll be back after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back. Let's continue our discussion on rhinoplasty. So I'm curious, is rhinoplasty or septoplasty covered by insurance?
If a patient's having functional issues with breathing, then yes, the septoplasty part can be covered. The aesthetic things that we're doing to a nose to change the shape, to make somebody happier with the appearance, that's going to be, it's an elective procedure.
Is there an alternative to a surgical rhinoplasty?
There is indeed. So there's a procedure that some people will call a liquid rhinoplasty. And essentially what we're doing is we're taking advantage of fillers. So the same fillers that we can use to add volume to people's temples, their lips, their cheeks, we can use to manipulate the shape of the nose. I think if it's done judiciously with small volumes, I think it's a reasonable option. Like anything, if it's not done well, you can either get an aesthetic outcome that doesn't look very good, and you run the risk of potentially compromising the blood flow to the nose. So when it's done poorly, you can actually cause big complications with skin loss over the nose. Next thing you have a wound that takes a really long time to heal. So you have to, it needs to be done very thoughtfully. I would say when you see a plastic surgeon, 9 times out of 10, if not more, you're going to get a surgical plan.
Okay.
If you're seeing somebody who's not a surgeon, who doesn't have that skill set, they're going to have to, if they want to treat you, they're going to have to go with a liquid rhinoplasty because they're not trained to do surgery. So I just, patient beware. I think it's for most procedures, you want to see somebody, in my opinion, who can offer you both options and educate you appropriately about both options so that you can make a really informed decision. But yes, there's absolutely alternatives to surgical approaches.
And what do you think maybe the 2 or 3 most important things that a patient should look for in a doctor if they want to do a rhinoplasty?
I think first and foremost, find a board-certified plastic surgeon or a board-certified ENT, somebody who does rhinoplasty surgery. And then from that group of doctors, find somebody who does a lot of noses specifically. So I am a board-certified plastic surgeon, but I don't do noses very often. So I wouldn't recommend people come find me for it. It's a fun procedure, and I did a lot in training. But it's not my primary interest. So, then you want to narrow that pool to people who really do a lot of the procedure you're interested in. I think that's key. And then from there, it's finding the personality, like find an office staff you like, a location that's convenient because you're going to be doing visits. Don't go overseas to have your surgery done because when you have a problem, it's really hard to fix. But, fortunately, in the United States, we have most of our cities with big populations have great plastic surgeons, usually have a lot of choices, so you can find that right fit for you.
And what are the average cost for a rhinoplasty or a septoplasty?
They can be all over the place. Again, it depends on your zip code. It depends on the skill set. Is this somebody who speaks internationally and you're going to pick the most famous rhinoplastic surgeon in the world? Or are you going to somebody who's been out of training for 3 days, right? They're going to charge different amounts of money. I would say typically, these are not inexpensive procedures. Most patients aren't coming in and with this kind of money in their wallet. These are typically procedures that are fairly expensive and patients are typically financing.
Yeah. You mentioned that they're going to be probably typically financed because they are expensive. What kind of financing options do you offer at your clinic?
Most of our patients use CareCredit. Again, it's a really stressful thing, I think, to take a large amount of money out of your bank and pay all at once. So using financing the same way you would finance a big purchase like a car, it takes a lot of the stress out of just making a decision for surgery.
Yeah, got it.
Yeah.
Well, you're very informative about rhinoplasties, and I want to do something kind of fun with you. It's called Myth or Fact. So I have 3 questions, and you're going to tell me if it's a myth or a fact. Okay?
Got it.
Now, this first one. Your rhinoplasty could melt in the sun.
Oh, total fact. We see it all the time. It's been a huge issue in 2023. No, I don't even. I'm not even sure I know what that means. Your tissues aren't going to melt. Nothing. Your bone's not going to melt. Your skin's not going to melt. I mean, But that being said, if we want to get serious for a second, we do want to be thoughtful about exposure to sun after surgery. Scars can be sensitive to sun exposure. So we recommend you want to protect your new scars from sun exposure, but melting not so much of an issue.
Okay, so that's a myth.
I would say we can put that in that category.
So myth or fact, rhinoplasty can also address medical problems.
Yeah, it can. So, if somebody has a functional issue like a breathing difficulty because the cartilage are sort of offset and they're blocking some of that nasal passage, putting that cartilage back in the right place can help somebody breathe, and that can make a big difference in somebody's life.
Would that be considered a septoplasty?
Septoplasty, yeah, exactly.
Okay.
manipulating the septum and putting it back into a better position for breathing, snoring, a whole host of issues.
Got it. I'm sure there's some husbands that could use that, so they stop snoring.
I think it works both ways.
Yeah, true. I know, true. Myth or fact, rhinoplasty will change your voice drastically.
I wouldn't say drastically, but certainly you have patients where, depending on the manipulation you're making, depending on the problem they're starting with and what you do, yeah, you can see voice changes because it's going to
Interesting.
change the way the air passes, through your nose. Dramatic, I wouldn't say we see very frequently.
Okay. Well, thank you so much, Dr. West. This was really fun and really informative.
Thanks for having me. I appreciate it.
Thank you. Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. For more information, visit carecredit.com.